All right. And so now we're going to bring on Dr. Kramer, and she is giving this course that I know that we were really excited about. I talked to her a while back after I was talking to the National Keratoconus Foundation, and it was actually Mary's idea from NKCF on what if we did some sort of presentation on what kind of resources are available for our patients, because I think as doctors, we may not even be aware that a lot of these resources exist for either our practices or the patients that are in our practice. So I'm really excited to hear from Dr. Kramer.
Hello. Hi, Steph. Nice to see you. Nice to see everyone. And it's a great program so far, and I'm really honored to be here. And I think, having keratoconus resources for our patients is just priceless, because just like any diagnosis, it's absolutely important that patients get reliable information and that they know or they have things that they can turn to in order to get more information. So I'm going to be talking a little bit about these resources, but before I do that, I want to talk a little bit about delivering the diagnosis. I don't know if there's anything else you wanted to add before I start, Dr. Wu, but...
No, go ahead, Dr. Kramer.
Perfect. So when you have a patient in the office, so optometrists are a lot of the time we're in primary care, and even if you're not specializing in contact lenses or keratoconus, you will see keratoconus. And if you're in an MD/OD practice, if you're working in corporate, if you're working in just a private practice, you are going to encounter keratoconus. So it's not just people who manage keratoconus or who work with specialty contact lenses that are going to see these patients. And so it's important, especially if you're not going to be managing it, or if you're not going to be working with these patients and fitting them for contact lenses or doing cross-linking, then it is really important to give them the right information. But let's talk a little bit more about the diagnosis. So this information was actually provided by the National Keratoconus Foundation. And in a study published in 2020, patients were asked what made an ideal doctor. So obviously medical knowledge is important, competence is important, but maybe not regarded as highly as a doctor's empathy. So bedside manner is actually really, really, really important. So of course it's important to be knowledgeable in whatever we're seeing, diagnosing, explaining findings and having clinical skills. But the way we communicate our findings to the patients are really important, especially if we're diagnosing something new. So it's important to listen to the patient's needs and emotional problems. So a lot of the time we're playing psychologist in practice, and that's, it's part of it. We can't take care of a patient's eyes without taking care of the way they feel about their problem, talking to them about it. So be kind, be warm, be present, definitely. Especially, like, I own the practice where I work, and especially as a practice owner, there's always things going on. There's people calling, there's patients who need phone calls, there's faxes coming in, there's emails, there's things, but we have to be there with the patient. It's very important. Greet the patients by name. So this is super important. The most important word to any human being is their own name. And I find that remembering their name, even if you don't remember their last name, let's say, but remembering their first name and talking to them as a real person and not just a patient or a number or someone you have to see that day, but greeting them by name, talking to them as if they were a little bit more colloquial, like more of a friend, will make a huge difference. Devote adequate time during the consultation to answer questions. So a lot of the time when we're making our schedules, we have, let's say, other patients waiting in the waiting area, or some patients take more time because it's a more complex case, or whatever may be happening. You really have to give patients time. So I know a lot of us don't make the schedules ourselves and we have, let's say, 4 or 6 or even sometimes more patients scheduled per hour, it's really, really important that the time you have to see each patient includes also time for questions, includes time for discussion, includes time for acknowledgement. Not everybody is just going to be like, okay, next. People want to understand, they want explanations. Not everyone wants explanations, but a lot of people do. And it's important to allocate time for that. Give information tailored to the patient. So don't just memorize things. Don't just have like a script that you use. Try to tailor it for each person. Customize what you're saying, personalize it to each patient, take their whole history and their person, their age and their gender and everything into consideration when you're talking to them. And that will make a huge difference in delivering the diagnosis. So any type of diagnosis can be scary, especially I think people's biggest concern is going blind, right? So they need to understand the severity of their issue. They need to understand what is keratoconus. And I saw this quote by Dr. Christensen, really good friend of mine and colleague, and it really resonated with me, and I feel like with this topic. So she said, sometimes I can't fix their problems, but I can listen and I can keep trying to fix them. To be effective, I need to hear what the patient is saying, and then I need to think about what the patient is really saying. So we can't always know all the solutions for each patient, but we can try our best. But the best thing we can do is actually hear what they're saying, listen to them, not just kind of have like automatic responses, but really process it and see how it is that we can help this individual person and not just think about it like a condition, right? So how do we deliver the diagnosis? Body language is really important. So basically it's like, again, timing is always an issue, right? So if you're spending your time on the computer and not making eye contact with the patient, that's a huge thing, because eye contact, people want to know that they're being listened to, right? If someone's busy typing or looking at a screen, I would think that they're not really listening to what I'm saying, or they're not really hearing everything I'm saying, right? So eye contact, facing the person, and then trying to remember and write it down for sure. And so basically just being attentive, because if you're not, that will definitely be disappointing to the patient. And if they don't feel comfortable sharing information with you, then they might not feel comfortable, telling you everything that's going on, which might make our jobs more difficult. So a lot of the time when we phrase a question, instead of just saying, okay, so I see that you're here for this, because obviously when they call, your staff in your appointment book is going to write down maybe patient coming in with keratoconus, wants scleral lenses type of thing. But if you just say, okay, well, you're here for scleral lenses, that doesn't really give the patient much room to be like, well, actually, I'm here because also my eyelids are drooping, or whatever it is that they're coming in for, right? So actually asking open-ended questions, it takes a little bit longer. The study shows it took about 27 seconds versus 11 seconds. So not that much more time, right? In the grand scheme of things, but it gives the patient more autonomy, it makes them feel like they're kind of owning what they're saying and kind of in charge, even though we're the ultimate people that are taking care of them and managing their eyes. They understand that they're kind of navigating a little bit where things are going. So what I do when I have a patient is I'll ask an open-ended question, even if I know why they're there. I'll say, what brings you here today? How can I help you? And then it allows them to tell me their history, even if I have their medical records, even if I know exactly why they're there, what I'm going to end up doing. But allowing them to speak and to listen to what they're saying maybe allows me to tailor the treatment a little bit better to them and to acknowledge certain things that might be different for them than for other people. And then once I make the diagnosis of keratoconus, you'll also have to be careful how you say these things, because some people might get scared, as I mentioned. Some people don't know what it is. Some people might be scared of going blind. So I think it really helps to have resources in the office. So paper resources, obviously there's a lot of online things, and I'm going to get to that. But the NKCF booklet, which I have right here, if you can see your video, it's me holding the booklet. I have a lot of these in my office. It's very, very useful. You can get them directly from the NKCF website, and I will give this to the patient. I won't just give it to them, but I'll actually go through the pages with them. Now, you have to see if time allows for that, but I really like this booklet because it explains what keratoconus is, who gets it, why. It explains a little bit about ocular anatomy. It explains about atopy. So obviously one of the first things we have to tell our patients is to stop rubbing their eyes, right? So that's all written here. Even have a picture of Tommy Pham. So it's a famous baseball player who has keratoconus. And, you know, it makes people feel more comfortable when they know celebrities have keratoconus. And then it talks about different contact lenses. So it will talk about soft lenses, glasses, rigid gas permeable lenses, piggyback lenses, hybrid lenses, scleral lenses, a little paragraph about each one. And it also then talks about procedures. So obviously outside the scope of optometry, but we'll talk about intrastromal corneal ring segments. It will talk about corneal cross-linking, and of course, everyone's biggest fear, which is corneal transplants, but it also talks about that. So I think this is a great resource. It is neutral, so it's not brand specific. And it's something reliable. I always tell patients this is a non-for-profit, so it's not like you're just referring them to a place that's trying to sell them something. You're referring them to a place where they can get reliable information and where they can find resources, more resources. So let's talk about online resources. So I mentioned the NKCF. I love this website. So this is like in addition to the booklet, obviously. As a practitioner, you can actually order your booklets on this website, but you should also send your patients here because there's so much information. So I have patients who go on this website all the time, and they're constantly updating it. So again, you have information about keratoconus, how does one manage it? What causes it? How is keratoconus treated? And there's different information, there's research as well. So people always want to know what's coming, videos, and of course, frequently asked questions. And then again, patients can also get the booklet directly from the website. They can get doctors' information, Down syndrome information, insurance information, other resources, and also there's a podcast, which I'll get to in a minute, and then there's news. So there's World Keratoconus Day and different newsletters that they subscribe to. So I have a lot of patients who really use this website all the time. And they get the newsletters, they know what's up and coming, they know what's being researched, they know what doctors are in their area. So this has really been, I would say, life-changing for my patients who have keratoconus. So obviously, if you're working a lot with keratoconus, I recommend having a stack of these booklets in your office. If you don't want to do that, that's okay. You can refer them to the website where they themselves can order the booklet. And like I said, just find all this information online. So there's another website, which I really like. This is livingwithkeratoconus.com. So again, explaining what keratoconus is. So it's really important that when patients are going to be looking online, that they're going to be finding reliable information, right? Because there's a lot of different information online, Dr. Google, we all know, and we just don't want our patients getting erroneous information. So I really like this PDF. It explains what keratoconus is, again, what progressive keratoconus is, treatments, about cross-linking. So obviously this website is a little bit more focused on cross-linking, which is really important, of course. And it talks about, FDA approved procedure for cross-linking. And so again, very useful information for patients, especially patients who you are referring out for cross-linking. I think that prior to meeting with the doctor that you're referring them to, it's important for them to understand the procedure, because a lot of the time when they go see the doctor, they might be nervous and they might not remember everything. So if they read about it first, then they can talk a little bit more about their doctor with it. So again, I really, really like this website, and I find it very useful for patients. I like it also because there's insurance information. So in a lot of plans will cover cross-linking. So this website will help patients know prior to visiting their doctor if their policy would consider covering them. So it's that you could see a map here with different regions. You can see different policies. You can see, anyways, it's a lot of information. So it's really good for patients who are, again, are considering cross-linking, who have insurance and who want to know if they're going to be covered. And that will give them more information again when they're going to see their doctor and be able to have questions if needed. So another thing that this website has is, again, more brochures about keratoconus, about cross-linking, and again, very, very useful to have. So I highly recommend this website too. And there's other links on this website going back to the NKCF, and there are other resources. So I love how all these websites kind of intertwine and lead to one another. Again, your patients are going to go online, especially if they've never heard of keratoconus. You just don't want them falling on information that is erroneous. So if you provide them with more information than they could even ask for, and you know that this information is reliable, and you know that it's based on it's evidence-based, and everything that is given to them is kind of neutral and important information for them, that's great. So the more information that you can provide with your patients, the more resources you can provide to them, the better. So I talked a little bit about this podcast. So this is by Dr. Clark Chang, and you can actually find a link to this on the NKCF website. So he talks about keratoconus. It's called the Chang reaction. You can get it using the app Defocus Media. So a lot of people will want a podcast or some sort of video or someone like explaining things to them in layman terms. I think this podcast is great. And it's much better than, for example, going on YouTube and just falling on some random videos. So I really do recommend this podcast for both practitioners and patients alike. Again, you can find it just by searching the Chang reaction, or you can go on the NKCF website and there's a link there, or you can look for it on Defocus Media. All right, so the Scleral Lens Education Society. This is a wonderful society. I'm actually part of it. I'm the treasurer, so I'm on the board right now. Dr. Stephanie was a previous president as well, and this is such a great organization. So this is actually for patients, right? So this presentation is mainly focused on patient resources. Obviously, there's tons of resources for practitioners, and we've talked about that in other lectures before, but I want to focus on the patient side of things. So if you're a patient and you're interested in scleral lenses because you have keratoconus. So you can actually go on this map, which is available on sclerallens.org. And you can see all the different practitioners around the world that are not certified, but are fellows of the Scleral Lens Education Society. So people who undergo the fellowship process have done a pretty rigorous pathway in the sense that they've definitely proven their proficiency or their clinical skills in fitting scleral lenses. So all these practitioners here have certain experience with scleral lenses that others may not. So it's very reliable. People who become fellows of the Scleral Lens Education Society have published at least one case report. They've done at least a poster, a presentation. They've done a mini test on scleral lenses. So they've accumulated a bunch of work that has been reviewed by the board. and only then will they receive the fellowship. So again, all the people who are listed here are fellows of the Scleral Lens Education Society, which again means that they have clinical skills or proficiency fitting scleral lenses. So this is really important. We know how important scleral lens can be for a patient with keratoconus, and it's a wonderful treatment, and finding the right person is key. So you can see from Argentina all the way to the United Kingdom, Nigeria, and of course in the United States. I just put myself up there to show you, but basically anyone who is a fellow of the Scleral Lens Education Society can have their practice listed. And if you're, for example, you're not someone who wants to fit scleral lenses, but you would like your patient to have scleral lenses, then you yourself can go on this website and look for someone. But this is a great place. Also, if you have a patient moving to Las Vegas, for example, I can go there and find Dr. Stephanie Wu there, for example. So this is a great place for patients to find people who fit, practitioners who fit scleral lenses. The GPLI, so the Gas Permeable Lens Institute, is a wonderful organization as well. And they obviously have a practitioner website with wonderful information for practitioners. And they also have a patient website. So this is what their patient website looks like. And obviously the focus of this website is gas permeable lenses, but you have always information about keratoconus when you're talking about gas permeable lenses. So here you have information about bifocals, testimonials, a little bit about astigmatism. They will also talk about scleral lenses. And then again, if you fit or want to find someone who fits GP lenses, so gas permeable lenses, you can look for doctors. So this has a doctor locator. You can search by the doctor's name, by the state, zip code. And then if you look at the bottom, I put myself there and you can see all the different things that the practitioner would be proficient in. So scleral lenses, irregular corneas, orthokeratology, so all these. So for example, for someone who has keratoconus, they're going to be interested in GP contact lenses or contact lenses for irregular corneas or scleral lens design. So you can tell your patients about this website, or you can ask, you can look it up yourself and print the information for your patients. And again, there's a whole bunch of information, mostly about contact lenses, but again, finding doctors around the country who are proficient in fitting gas permeable lenses. Also on this website, there's a really great video of application and removal, lens handling and care. So it's a wonderful instructional video about the proper care and handling of GP lenses, which you can find. So this is a great resource for patients. You can show these videos to them in the office when you're doing application and removal. You can show it to them, you can send it to them so they can watch it at home. There's also a video about scleral lens care and handling. So again, it's not just diagnosing keratoconus, it's finding resources that your patients can use from when they're diagnosed to when they get their contact lenses, and being comfortable putting them on and taking care of them and everything that goes with keratoconus. So more websites. The American Academy of Ophthalmology is a really great website. It has, so you can search anything up there. So all I did was I searched keratoconus. So this is for your patients who are Googlers, right? So these are people who want to understand the condition, they want the treatments, they want to understand the cause, they want to understand everything about it. Don't send them to Google, send them to the American Academy of Ophthalmology. All this information. So what I really liked about this is that it's constantly reviewed, it's updated. So this is actually from March 25th of this year. So very recent, and this is work that they're doing all the time. So the information is always up to date. And of course, Spanish resources. So for patients who are Spanish speaking, all you got to do is just click on this button, or you can click on the article itself and it will translate it. So really, really great resources in 2 different languages. So awesome. And then again, there's tips for prevention, there's patient stories, there's a whole bunch of resources on this website. Other useful websites, so the IKA, so International Keratoconus Academy of Eye Care Professionals, which will have great resources. iPrint Prosthetics also has really, really great testimonials. They have patient information about keratoconus. They've got information about the condition. They've got information about contact lenses. The Contact Lens Society of America, which is an important organization, and also will have links to the NKCF. They'll have resources there where patients can click on. So again, it's just surrounding your patients with reliable resources that they can go to. The American Optometric Association, also the American Academy of Optometry will have information as well. And a lot of these websites also have doctor locators. So again, the doctor locator is something that allows patients to look for practitioners that are in different areas around the country, around the world, who are proficient, who are specialized in keratoconus. So what about research? A lot of patients want to know what's new, what's up and coming, what's in the pipeline, especially those, I would say, with advanced keratoconus. This is going to be probably the most reliable resource for up-to-date research, for clinical trials, for retrospective studies. So the National Eye Institute, again, it's a website, but it's the nation's leader in vision research. So patients can go here, also available in Spanish, and they can look anything up, and they can read what's going on, what's up and coming. And again, there's so much different information online. It's so important to have reliable and evidence-based information available for our patients. So definitely send your patients here. You can also, as a practitioner, print out some studies and have them in your office. I would recommend going here and printing them out and just handing them to your patients. I like to create booklets for my patients that will include, the NKCF booklet, will include some studies, will include some information about scleral lenses or a hybrid lens or whatever type of lens I'm recommending for that patient. And then we also have the NEI, which National Eye Institute created the NEHEP, which is the National Eye Health Education Program, to help fulfill a vital aspect of their mission, which is to educate both professionals and the public about the importance of eye health. So it's a organization that works closely with health professionals and health educators to create resources and tools that we can use as practitioners to raise awareness in our communities. So it focuses on importance of early detection and treatment of eye diseases. So we know how important that is in keratoconus, benefits of vision rehabilitation, and populations that are of high risk of eye disease and vision loss. So they've got 6 different areas, but they do have a lot of information as well about keratoconus. And again, this is by the NEI and available online. Boston site has a really great website as well. So they do explain a lot about keratoconus and corneal ectasia. They'll talk about different practitioners that are available to help, technology, and also research. So this is a really great website as well, especially if you are fitting Boston site lenses. You can send your patients to this website so they can learn more about the type of lenses that you're fitting and also about the condition itself. So it's kind of a one-stop shop. Another website, there's a lot, but these are all really great and distinct in their own way. So I like All About Vision a lot. And again, this is for your Googlers. Like, you send patients to reliable websites where they can learn about symptoms and signs, causes, treatments, also available in Spanish. And again, what All About Vision also allows you to, they have a practitioner locator as well. So it's a really great website. And the information is very reliable as well. So again, Spanish available, and they do have the doctor locator. So I like this Keratoconus FAQ page. So it talks about, for example, the first question was, I was told RGP, so rigid gas permeable contacts, will stop keratoconus from worsening. So is this true? And the people who are responding are MDs, they're ODs. So it's not just any random person. These are people who have been carefully selected to respond to these questions. And so a lot of keratoconus patients, I mean, in the 15-20 minutes that they get to spend with their practitioner, they might not think of all these questions, or they might hear from someone and then think about it at home and look it up. So you really have to make sure that they're not thinking, or that they're not getting the wrong information. So I really, really like this page. And you can print it out and put it in that booklet I was talking about and hand it to your patients, or just direct your patients to the All About Vision website, sorry. Okay, so this is actually my website. So I think it's important, as if you are in private practice, or if you have your own practice, and if you are specializing in keratoconus, to have a page about keratoconus. Not just so patients can find you, but once you diagnose the condition, so that they can go on your website and see, well, I know my doctor diagnosed me with keratoconus and she recommends this, but is it reliable? What do other patients think? Is this practice really specialized in keratoconus? So if I have a condition, I want to go to someone who's really specialized in the condition. So I want to make sure that their website is covering that information. And on the website, I also, like I said, I included patient testimonials of people who have keratoconus, who are wearing, for example, scleral lenses or other types of lenses that I work with in the office. So really, really important. If you're specializing in keratoconus and you are a contact lens practitioner, you're a contact lens specialist, definitely put this information on your website. Not only will this allow you to get patients who have these issues, but more importantly and more relevant to this presentation is, if you're diagnosing a patient with keratoconus, you want them to be able to go on your website and feel comfortable that they're coming to see you and not someone else, and finding information that you wrote, or obviously reliable information that you wrote, that you reviewed and put on your website about keratoconus. All right, so what if you're not in the States and you work in another country and you want to make sure that your patients are getting information? Well, there are tons of websites around the world for patients in different countries: Japan, Poland, Canada, and Australia, New Zealand, France, the UK, Netherlands, Germany. So all these are all just different shots or logos from each individual website that I put together, just to show you that if you have a patient that's in Australia, you have a patient that's moving to Japan, you have a patient that's in the Netherlands, and I'm sure there's a lot of practitioners here listening who don't live in the States. Well, you have local websites that are in your specific language. So, for example, Association Keratoconus is for French, so they have everything, all the information that, for example, the NKCF has, but in French. And they're like likewise in Japanese. So for patients who, again, require this type of information, would like this information in other languages besides English and Spanish, or who want to find practitioners in their local country, they can find them by going to these resources. There's a lot on social media, but I put together probably the best groups for our patients. These are private groups. Most of them will not allow you in if you're a practitioner. So this is for patients only, but there may be some of them that do. So, but I really like this Keratoconus group. I like what they were posting, just these messages, like shout out to all of us fighting a battle that most people don't understand. I have patients that I've really taken the time to speak to, and people really need this type of resource. They really need to go on a group and just talk to other people who have this condition. Some of them have very advanced keratoconus. Some of them cannot see a thing without their lenses. And of course, we have amazing lenses for them, right? But it's scary to wake up in the morning and not be able to see anything. And most people don't understand that because, some people are just, that have -2 or spherical, so they put on their glasses and everything's fine. And so people with keratoconus cannot do that, especially if it's moderate to advanced. And so just being in a group like this, where you can just throw anything out there, kind of like us, we have our scleral lens groups and our dry eye groups where we bounce ideas around to people we know and trust. And it's the same thing for people who have keratoconus. They want to talk to other people who understand. So I really, really like this group, keratoconusgroup.org. They all have a website, but this is their Facebook group. And everyone has Facebook, so it's really great for these people to be able to go on and see that. And Keratoconus community, so they've got 10,000 members as well. And again, this has been set up for people with keratoconus, PMD, and their family members. Just chat, just talk, and bounce ideas to each other. So these are private groups, and they probably ask you a few questions to join because they want to make sure that their members are not spamming, that they're not necessarily practitioners, that they're actually people who have keratoconus. Here's another one, Living with Keratoconus, group, 9,000 members, again, a private group. And it's another community. They've got Facebook, Twitter, Pinterest, and it's a great group, again, where people can bounce ideas off each other. Reddit. So what is Reddit? Reddit is a place where people will ask questions and then people will answer. So as a practitioner, you can actually go on Reddit and answer questions, but basically anyone can answer these questions. So, the information might not always be 100% reliable depending on, what the question is and what the answer is. But if you, for example, you want to know, has anyone tried hydropeg on their scleral lenses for keratoconus type of thing? And then people will be able to answer like their experience. So Reddit is a great place, and this specific page about keratoconus is out there and definitely would be a great place to send patients if they want to ask questions and get answers. So let's talk about other resources that are not just information or chat groups, but these are advocacy. So the NAEA EVR, or National Alliance for Eye and Vision Research, is a non-for-profit advocacy organization comprised of a coalition of nearly 50 professional, patient, and consumer and industry organizations involved in eye and vision research. So this is an organization that is sponsored by the National Institute of Health and the NEI, Department of Defense, Department of Veterans Affairs, and other federal agencies to pretty much make these conditions, for example, like keratoconus or other conditions that are serious for, vision wise, and create awareness, and basically putting everybody together, professionals, patients, consumers, industry, and organizations together to fight for these people, to make these conditions, to increase awareness about these conditions, to increase resources for these conditions. So a great website where you can send your patients. And there are other ones. There's Prevent Blindness. There's the Cornea Research Foundation of America. There's the Royal National Institute for Blindness as well, which is a UK based advocacy website. So these are different websites, again, kind of grouping everyone together, trying to increase worldwide, resources and awareness of various conditions, not just keratoconus, but keratoconus is a big one, obviously, because it's so common. All right, so another website, kcglobal.org, is kind of a chat room. So you can see here, this is just a screenshot, but you can see there's some recent ones in 2022. So in pursuit of excellence and safety, quality, teamwork. So you have to be a member here. So it's just a chat room where you can, again, kind of like Reddit, where you can go in. Here in this specific one from this year, there's 50 different topics, 258 posts. Again, this is very specific to keratoconus. So if people want to go on and chat, they can do that. So I love this just sense of community that you can find. I learned so much just putting this presentation together. I didn't even know a lot of these resources were available. So I'm really happy to share it with all of you. But I love that all of us versus keratoconus, and just like these people coming together and talking and chatting about it. Another support group, so the keratoconus support group. So again, what are options to see better? Contact lenses. These are just different posts and questions and answers that people can, discuss together. This one has 74 members, 91 posts. And of course, you as a practitioner, you can try to go and maybe answer some questions and help, people get reliable information. But you can also send your patients to these websites so that they, again, have a sense of community. I find, that just feeling of solidarity and talking to other people who are going through the same thing or who have gone through even worse and are able to help you, it's really, really priceless. So that's it for me. I would be happy to answer any questions. I know it's a lot of resources, but you can never have too many, I guess, too much information, reliable information for patients.
Wow. I mean, I had no idea a lot of these existed. And that was really cool that you were able to find some of this information in other countries. Like, I didn't even know that these things existed. So that is absolutely fantastic. Yeah. I had a question for you on when patients are coming in and some of the social media sites that you referenced, and they say, well, I saw this, this person is filling the bowl of their lens with Opti-Free Pure Moist. Is that okay if I do? I guess, do you feel like it's kind of a good and bad thing, some of these social media platforms?
So I suppose, yes. And like I was saying, those Facebook groups, those Reddit type of chat rooms, I think it has pros and cons. Obviously, the pros are a sense of community, solidarity, just feeling like you're not alone type of thing. But in terms of the quality of information, there's really no control over it. And I think that you have to tell patients to take it with a grain of salt. I think that if you give them reliable information like the NKCF brochures, the All About Vision websites, the ophthalmology, American Academy of Ophthalmology websites, and you tell them go here for information, but use those groups to connect with other people who have this, and maybe not base your clinical decisions on that. So for example, you as a doctor are responsible for giving your patients the correct information about how to handle their lenses. And you have to explain to them that they may talk to other people who do it differently, but this is the way that you recommend that they do it. And so that's really important. So I would say, the information that they're getting from other patients, to take it with a grain of salt. But for a sense of community, I don't think you can really find that anywhere else than social media and the support groups.
Yeah, I agree with you. I think that like they're good and bad. Like, I mean, imagine like years ago when they were probably like the only person they knew that had keratoconus, and now to have access to people that have keratoconus all over the world, that's got to be that has to provide some sort of comfort to them, that they have people that they can talk to, and like you said, shouting out to all of the battles. And there was a really great post they had the other day on, this is what like a normal person sees, and it was like a picture of like I think it was like a drive-through menu or something like that. And then they're like, this is what keratoconus patients see, and it's like double vision, really shadowy, like glare, all this other stuff. So I think that kind of stuff is really neat.
Yeah, things like that. I think you got to be careful with the information you're getting in terms of like clinical things and information about the condition and progression and cross-linking. But in terms of like that community feel, I think it's so important for patients to have. So it's a pros and cons type of situation.
Yeah. And then I guess last question is, let's say that you have a patient that gets newly diagnosed with keratoconus in your office. Are there like 3 things or 1 thing or a bunch of things that you're giving to them as far as resources? Like, what is like the maybe 3 things that you're doing like right off the bat when you're educating them? Like, this is the disease that you have. Here's how to learn more information that's reputable. What are you kind of doing right off the bat?
So right off the bat, 100% of the time I'm giving them this brochure. So I have tons in my office, and I definitely encourage them to go to the website as well. I encourage them to go to my website, where I constantly update the information and, subscribe to my newsletter. And then I am going to fit them or encourage them to be fit with a contact lens. So depending on what type of lens, often it's a scleral lens. So I'll give them information about the type of lens. And then I will make sure, if they haven't already had cross-linking, that they're scheduled for a consultation. So those are the resources that I absolutely do 100% of the time. And then, if they specifically say like, is anyone else? Do you know anyone else who has this that I can talk to, blah, blah, blah. Or if they want specific kind of to look on a specific website, like I want to learn more about this, where can I go? At that point, I will recommend either one of those groups, or I'll recommend, any of the websites that I talked about, so that they can read about keratoconus, and have reliable information.
That's great advice. Well, thank you, Dr. Kramer. This was an excellent presentation. Lots of incredible feedback on the survey already. So thank you so much for spending your time with us and for giving us all these amazing resources that we can give to our patients.
My pleasure. Thank you so much for having me. Great program.